Now, in this bizarre, paranoid, locked-down nation, there are all sorts of people in all sorts of strange situations around the country. One of them is New South Wales Labor Senator Deb ONeill, who's locked down in the ACT in Parliament House, waiting for another session of Parliament next week. I'm glad we can help you fill in some of your time, Deb. Tell us your thoughts on where we're going.
Thanks, Chris.
Tell us your thoughts today. Big announcement from the Prime Minister today, really, on the Pfizer vaccine being available at the end of the month for all young adults, 16-year-olds through to 40-year-olds. Now, there's a lot of young people have been hanging out for this. They don't want AstraZeneca, thanks to ATAGI poisoning the world there. So this is going to really ramp up the demand for Pfizer, isn't it?
Oh, yeah, look. There was always going to be a need for a range of vaccines, and smart countries got on with that job properly last year. And, you know, the situation we're in right now with that anxiety amongst young people just desperately waiting for this delivery could have been completely prevented if Scott Morrison did his job in 2020 in June when he was offered 40 million doses. People need to remember that. He got offered 40 million. He said, no thanks very much. This is why we're in this massive race to try and get people vaccinated. And, you know, I know, like my own kids, they're in their 20s. They've all gone and got the AstraZeneca because they knew that they couldn't rely on this government. And as much as I'm really hoping that that announcement comes to pass, I just have so little confidence in the Prime Minister to actually deliver on his word for the Australian people. And this is a situation where his word matters in terms of lives. Well,
I'm glad your kids have got AstraZeneca.
New cases in Newcastle today.
No,
yeah, they just did it. I mean,
I'm not going to challenge your criticism of the Prime Minister, because I think the federal government and state governments have been tardier than they should have been on vaccine rollout. But the other reality is that AstraZeneca was a great decision by the federal government, a domestically manufactured vaccine that saved the UK. There's unlimited supply. And as I say, the world's been poisoned by ATAGI. If I was a senator like yourself and I was on a committee, I'd love to get the people on ATAGI before a committee and just drill into them about their terrible advice on AstraZeneca, because it's really done the nation some damage, and we must make sure they never do that again.
Yeah, but if you have advice to the government, I mean, people elect a government to make decisions. The health advice should inform the decisions of the government. The problem is Mr Morrison only listens to what he wants to hear.
Oh, come on. Imagine
if it doesn't turn out right. Oh, absolutely he does. If the government had
rejected ATAGI's advice on don't give AstraZeneca to people under 50, you would have been onto them like a ton of bricks. That would have been a disastrous policy choice for them.
But I can tell you about how the Prime Minister managed that. It's playing out in a really bad way in Dubbo right now. In March, I was in Dubbo and I went to the Aboriginal Medical Service there. What I saw shocked me. An amazing Dr. Amy was there looking after people in the practice. It was funded for 5 doctors. But the supply of doctors and GPs everywhere and in AMSs is so bad because of the bad policy making by the federal government that they didn't actually have the 5 doctors. They only had her, 1. Now, the week before, she'd had a clinic and got got a pretty good roll-up. 80, I think she said, in the first week that she got in for the injections. They were all lined up at that AMS in the middle of Dubbo to come and get their injection on the day that I visited. And when I went in, the nurse practitioner came in who was running it and said, they're cancelling. 50 and 60 of them were cancelled that morning because of the way that the Prime Minister announced it. Now, he's into the announcements. He loves the microphone. He wants to be there telling us everything. And instead of really judiciously making the right calls at the right time, his failures put us in this situation and have exacerbated the trauma that people are going through.
But you'll understand, and whatever about the tardy starts, it's really ramping up now. The number of vaccinations each day is fantastic, which is encouraging news. The other part of the debate is living...
Because it was always a race, Chris. It was always a race.
We've got to live with the virus, right? We've got to get rid of this zero COVID obsession that the state premiers have been running with. Gladys Berejiklian's been very upfront about it today, saying New South Wales is going to live with the virus. That means all the other states are going to have to get used to it too. And here's what Scott Morrison said after that today.
There's no COVID in quarantine. There's no cases in isolation. There's just zero COVID in Australia. That has never been Australia's goal, ever. What we're seeking to achieve is cases minimised as far as possible, preferably to zero, that are infectious in the community. That's what we'd like to achieve, and we have to act in accordance with that. Now, I think the Premier is being very realistic about what the opportunity to do that now in New South Wales is.
Yeah, I think this preferably zero thing is nonsense. This disease is endemic and will be, so we've just got to accept levels of infection. Can we do that politically? I know the media has trouble not sensationalising it, but what about politicians?
Look, you just can't. You can't keep up with the head spins from listening to what Mr Morrison says one day to the next. You know, it wasn't a race. Oh, yeah, then it's a race. Oh, we can't fix this with lockdown. Lockdown's the only way. Oh, we can't fix it, but we can't vaccinate our way out. The next thing, it's just vaccination. He'll say anything on any day if he thinks it's going to get him out of trouble, you know, out of hot water. The thing is, if we do get to this point where we live with the disease, when is the point at which that isn't being paid for by lives, particularly now of young people? I mean, if we're going to talk about living with the disease, Chris, we should actually have a pretty honest conversation about what it's like dying with the disease, because that is the other side of the coin that we have to have the conversation about.